Good morning, everybody. Looks like it's going to be a such and such so-so day, but it's Miami. It's during the rainy season. We know we expect rain during the day, but it's still so beautiful in Miami. It's still warm. It's still heated. Bicycling, running on the streets early in the morning, late in the afternoon, early evening. Please make sure you don't overheat and take care of it. Today we've got a beautiful little lady, Madonna of Port Lagat. Dolly was so much influenced by the Catholic Church, and that's where he came up with the name the Madonna of Port Lagat. And also you see this here, it's mother maternity, it's concerning the babies and women and having kids and those type of things. And that was really Dolly's, one of his main centerpieces of religion and things he did. And I mean, Dolly just did such incredible things, and from day to day, you'd never know what kind of crazy ideas or things he would do. Hey, you should read a little on Dolly because he's just probably one of the most incredible artists and characters ever in the world. He has probably more production of different types of artwork, and that's because his wife Gala was interested in money. So every time she had someone to work with who would produce and help to sell his things, she came up with more ideas and more things, and that's what they did. It's great. Dolly's a great man, but today we're talking about something really important and something really that has also affected me. When they talk about low back pain and PRP and a type of stem cells, people come up with questions. It's not like extremities when you use PRP and a type of stem cells that's really fabulous. Backs, who knows, but recently, I had injections of PRP and a type of stem cells in my back. I've had back pain for 15 or 20 years. I've been recommended for surgeries. All I do is get my adjustments and my therapy, and that helps me. And then I get my adjustments again. But because of this, I had the PRP and stem cells, a type of stem cells, not stem cells, a type of stem cells. My back is doing fabulous. So we are doing that with our patients and friends and people we know. So, it's important for you today to look at these things and to be aware, because sometimes it's not regular type of medicine that they would prescribe, but instead of getting back surgery and steroids and other things, it's really something to help. And I'll tell you, I've never been so happy because my back is pain-free. It's just incredible. But that's how it is today. Today, let me give you a little information, okay? Lower back pain is one of the most common complaints among men and women, and the bad news, it can get worse as we get older. Pain in the lower back have different causes, but if lower back pain is related to problems with a cushiony disc that separate each pair of spine bones in a vertebrae. In fact, it's a problem that causes sciatica, one of the most common types of lower back pain. That's when the pain radiates down the hip, into the thigh, into the legs, and sometimes into the feet and toes. And it can be very debilitating. Now, injections have been used for many years to reduce inflammation around slipped or herniated disc in the lower back. And until recently, these injections have contained steroids or other medications to relieve pain and swelling. Most recently, researchers have begun exploring natural alternatives to their drugs, including platelet-rich plasma and a type of stem cells. And because PRP is derived from your own blood, it doesn't come with the same risk as steroids and other medicines. Plus, while steroids may relieve the symptoms of low back pain, PRP injections with a type of stem cell can actually help repair the damage that's causing painful symptoms in the first place. And here's how PRP work with the stem cells to lower the back pain. How does it work? As the name implies, platelet-rich plasma and a type of stem cells contain a high concentration of platelets, one of the essential building blocks of blood. Platelets contain chemicals called growth factors, which play a big role in healing. They also contain special proteins that signal stem cells in the area surrounding the wound, prompting those stem cells in the area to move into treatment area. Together, growth factors, signaling proteins, work to generate new healthy tissue that's used to repair damaged tissue. That's imperative. These wound healing processes occur naturally, but the problem is they don't always occur right where we need them or fix the necessary optimal repair. By directly injecting them into the lower back, these growth factors and proteins are concentrated right where they need to be so they can begin healing, repairing damaged areas to relieve pain and restore normal function in the spine. What's interesting is when I'd stand up for a long time, the back pain would hit me. Sometimes when I'm sitting in a seat and it's not right, it bothers me. Well, today, I can't tell you. It is absolutely amazing how much better I feel and how it is. This is something that each and every one of you have to think about. It's besides using it in our shoulders, our knees, our elbows, our ankles, our hands and fingers, feet and toes. PRP and combining it with the type of stem cells takes it to the ultimate level. And I'll tell you something. Boy, it's great not having pain. I'll tell you, there's nothing worse than having pain in your neck, in your back, and that's what we need to do. And at Affiliated Healthcare, we're the healthcare center with a heart. And remember, you can always reach me at 305-389-9513. I can help you. We have a staff of pain management doctors, nurse practitioners, and others who are there to help you with your problems. It's kind of cool. We're here. We're here to help you. We're here to get better. We're here to help. Now, I'd like to say hello to a few friends that are watching us. Gary Hapsel, Fran Miller, Mario Quintera, Rebecca Fitt. Is it painful to do the procedure? There's a question that came up. Can I tell you? It feels like just like a regular shot. I think they did 3 or 4 injections. I got up. There's no recovery time. You lay on the table. The doctor, of course, looks at your MRI. He wants to know what he sees so he knows where to inject it, or the nurse practitioner. They're both experts at this. But it's amazing. They say 40% of Americans, one time in their life, will have low back pain. Well, sometimes, like me, they have it for many, many years. And it's not painful. It's like you get a shot or like they're taking blood. It's simple, it's easy, it's nothing. It's so simple, it's easy. And I'll tell you, I've always been afraid to get shots in my back. Twice I did some steroids and it really didn't do anything, and I just wouldn't recommend it. Also, stem cells in PRP in your neck is very questionable. And that's something that I would not really see that we should do. Okay, doing PRP and a type of stem cells in your joints and in your back are very, 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 very useful. And it can and does help. And, you know, I don't know if any of you, and probably a number of you that are older especially, who've had back pain for years and feel it. It kind of grows on you. It aggravates your life. It causes you to be disheartening with things that are going on, and you say, you know, why do I have this? Why does it bother me? Well, when you use the natural growth processes and proteins and your body's own PRP and the type of stem cells, it's incredible. Because we all want to be pain-free. There's nothing more important than getting rid of pain in your body and being healthy and being able to do things as you do it. I mean, there's a lot of people in their work that have to be in their vehicle, in their cars, and they're there so many hours, and it becomes so painful. But the good news is we can help you. At Affiliated Healthcare Centers, we're the healthcare center with a heart. And also remember, PRP can be used in other areas too. You know, it's really cool because what they did is they did PRP and a type of stem cells on me, and instead of using Juvenex, that's a filler, that's a chemical, they took my PRP, they heated it up, and you can see on this side, the line is gone, and this side I barely have a line. They used to be very deep lines. Also, they did it on the side of my face, and it helped to give it a little more fullness, to make it look better, to like you look healthy. healthier, and my skin seems to be so much more robust and healthy and alive. And all I can tell you is that there is a chance to get rid of your back pain without doing surgeries and major procedures. You need to try PRP and this type of stem cells. Oh, also too, I forgot, it does help the hair. I've done it a couple of times in my hair and it's helped. Now, if you're 25 or 35, it helps like frickin' gangbusters. I had a young chiropractor we did that on, and man, all of his hair was just like came back. It looked so vibrant and so young and so beautiful. So remember, there's things to do that we can do with our own blood, with type of stem cells that can help to heal your body. Listen, it's been great talking to you. Remember, my name is Dr. Barry Indurak. I'm a chiropractor at affiliated healthcare centers, and we're there to help you. Our main office is where we do these procedures at 8000 Southwest 67th Avenue. But we have offices, like I said, our main is South Miami, West Kensal, Homestead, Tavernier, and those are our offices these days. And we're there to help you and to take care of you. Remember, my cell is 305-389-9513, and also too, remember, our office is 666-8883 with area code 305. Listen, everybody, have a great week. Enjoy, take care, and bye now.